Hi, welcome. Thanks so much for being here. I'm Dr. Michael Caldwell. I'm also the faculty advisor for Meharry to the American Red Cross, and we're here going to talk to you about something very important to Meharry. I'm joined here today by two fantastic medical students, a third-year medical student, Noah Thomas, as well as our second-year medical student, Sacha Choupa. The Meharry has been involved with the sickle cell for a long time. This newer initiative, which we're going to talk to you about, is really exciting for us. And I think it's just perfect for Meharry.
All right, so just to kind of give everybody an overview of what sickle cell is, in case you guys don't know, sickle cell is an inherited disease. It affects the hemoglobin, which is the oxygen component that carries our blood. Normally, red blood cells are biconcave in shape, so they look like little donuts, right? But this mutation ends up causing it to sickle. So in the process of that, you can't have the ability to kind of carry the oxygen, and you don't have the ability for it to change the shape as it enters and exits out of different blood vessels, which is an important component for blood cells that's going on. Mm. And so why is it important? Sickle cell has an autosomal recessive inheritance. Affects 1 to 3 million African Americans in the United States alone. And so kind of to talk on some of the complications you'll see from sickle cell, this is a lot of things here. We threw a lot at you here on this slide. So moving forward here on how to treat, unfortunately, sickle cell is a lifelong disease. There's no cure for it. Bone marrow transplant is only the current cure available, but you know those results vary from person to person, right? Okay, so now this brings us to the point. So what is Meharry going to do to help? Right off here for you.
Yeah. So one thing I was excited about again is the Sickle Cell Center. The history there. It was created and started by the Elam administration in 1971, and last year, a part of the blood drive is we were celebrating the 50th year anniversary of Meharry Sickle Cell Center.
Okay. So on the next point here, the American Red Cross. So we asked what Meharry is going to do, so now we need to ask what the American Red Cross is going to do, right? So this is an exciting portion here to kind of change the pace here. American Red Cross has launched a new national program, which is called the HBCU Ambassador Program, which I'm a part of as well. It does make a difference. The national shortage of African American donors, hence the shortage of culturally matched blood. We ended up seeing, and this is kind of a bragging point for Meharry. This is what I'm very much so proud of, and with the help of these two, you know, I couldn't have done it without them. They played a vital role in how much of a jump that we saw at Meharry. We ended up having the highest average pint per operation.
Coming
next
up
one is soon. Next week, Friday, November 3rd, from 12 to 6 p.m. Again, I have a wonderful team here working with me. You know, from getting the people to sign up for the donations, to pubbing it, to working with me when I'm super busy and I kind of got my hands tied, and them being patient with me. You know, I really couldn't have done it without the amazing team that I do have here at Meharry, and I think it's, you know, really driven out of a place of love. We love what we do. We love the community that we serve, and we have powerful stories behind why we're doing what we're doing.
This slide up here, the date is Friday, November 3rd. We're filming this the week before, so hopefully we'll get this out. And but if you're watching this and it's after this date, then please find out when the next one is. We'll try to update our videos for always letting people know the next one, but it will be in the Wells Ballroom. Now, is that in the Cal Turner building?
Mm-hmm. It'll be upstairs.
And there's no one better to do it and lead it than us, I think, at Meharry Medical College for a lot of reasons. So I want to thank you.
So thinking again of what this blood drive means to the people that it's going to is why I am here, because as he mentioned, it is not easy, it takes work. But as our school motto, worship of God through service to mankind, I am here just to serve. So I am here to do the work because there are people that need it every day. The people that we go forward and we do all this work for are very in need of everything we're doing right now. So thank you.
Thank you. Thank you both so much. And thank you for joining us. Please pass on all the information. You could reach any one of us through our Meharry emails. And we look forward to seeing you at the blood drive. Please help us. We really need the help. Thank you.